Okay.
Welcome,
everybody.
Hi.
This is the Ask Me Anything Facebook Live event, Monday, October 19th, Dr. Simonds Metabolics and Weight Loss. Everybody, you probably know me, Dr. Simonds. This is Michelle Kennedy, nurse practitioner Michelle Kennedy.
Hello. Happy Monday.
Good to see everybody. We want to thank everybody for sending in questions. It's really awesome. Everybody's been doing great sending in questions. We really appreciate your good questions. Keep sending those things. Can't say that enough. We're open today. We've been open since the start of COVID, and we're going to stay open, right? So we're open in both locations today, both Raleigh and Durham. Today we're in the Raleigh office for those of you who might be tuning in the first time. We're on Falls of Neuse Road out near 540, and it's a great location if you live in North Raleigh, right?
Yes.
So we've got a bunch of questions today, don't we?
We do.
We're going to pick up on one that we didn't get to last time.
Yeah, really good question came in from Jamal. It might have been two AMAs ago. We keep saving it because we haven't gotten to it. It's such a great question. So thank you, Jamal, for your question. The question is, how can I figure out how much protein I need to be eating daily? Is there a formula? Is it okay to use protein powder to reach these goals? For the last question, yes, it's okay to use protein powder. We sell some in the office. We give you recommendations. Whey protein powder is probably what we recommend the most, although there are some really great plant-based ones out there. And we have, for years now, really stuck with the idea of 30 grams of animal-based protein per meal. That's really what gives us this big metabolic boost. It keeps us full. It keeps our blood sugar stable. Has really, really good properties for making sure that as you lose weight, it is body fat and not lean body mass. So 30 grams a meal. Now for females or for individuals who are smaller and weigh less or have less lean body mass, they may need a little bit less, maybe more like 60 to 90 grams in a day. Most women, it's about 90. It's about 30 per meal, 3 times. And then men, sometimes there's a 4th serving or even a 5th serving of protein.
That's correct. And I think the thing to say here is that, that fat and carbohydrate don't raise your metabolic rate when you eat them. But if you reach about 30 grams of protein in a meal, it significantly raises your metabolic rate for a few hours. And that's really important. We want you to have that increased metabolic rate. The other thing I would say is I get a question a lot about could I eat too much? Isn't that harmful to eat all that protein? No. My God, no. Okay, no. I can't say it enough. Eat protein. It's good. Okay. America has a problem. We are deficient in protein and we eat an excessive amount of carbohydrate. It would be impossible to eat too much. You couldn't do it. Okay. Unless you're on dialysis and have to have what you eat regulated very closely. Okay. That you will absolutely, you cannot overdo it on protein. Some people say, well, what if I ate 200 grams a day? You'd be fine.
Right.
That's 800 calories.
You'll be
That's
really,
right. You'll
really
be very full.
But you'd be fine.
That's right. You'd have to eat 1,000 grams of protein a day to run into it. You try going beyond 200, and I guarantee you can't do it.
Yeah, it's going to be hard.
Right. You'd have to eat an entire animal in one day, and you couldn't do it.
Yeah.
Right? So and I'm talking about an animal the size of a goat or a small cow. And you couldn't do it. You just couldn't do it. So don't be scared. Don't let anyone talk you into that bunch of nonsense.
Right.
Okay.
Right. So there's not necessarily a formula. It's just about 30 grams per meal.
Yeah, that's correct.
Athletes do, I shouldn't say that. Athletes do sometimes follow formula like per pound of body weight or per kilogram of body weight. And we have a lot more information on this on our website, simonsmetabolics.com. We talk about protein a lot. We have blogs. We have other information, links to places where you get meals delivered that are high protein, lower in carbohydrate, because that really is what we see work best.
Yeah, that's right. So don't be scared of protein. Protein's a good thing.
Protein is great. Yeah. So
you can't overdo it.
Jamal.
That's right. You can overdo carbs.
And what it looks like, just to give you an idea, 30 grams of protein is about 4 to 6 ounces of meat or fish.
Yeah.
Or about 3 to 4 eggs with a little cheese on top. So you can do it in a combination of meat, cheese, eggs, seafood, protein powders, things like Greek yogurt, cottage cheese. So you have different varieties. You don't have to just eat a dry chicken breast every meal to get a good amount of protein.
That's correct.
There's a lot of really tasty ways to get protein in.
totally agree with that. So I hope that answers your question, Jamal.
Mm-hmm.
And I'm glad you asked it. So
yes.
Let's go on to the next question.
Charlotte from Durham has sent us a question. She enjoys exercising for mental health, but she knows she's very hungry on the days that she exercises and has a harder time sticking with her plan. She just wants a snack all day. So she wants tips on how to exercise effectively while maintaining hunger levels. This is a biggie. We face this multiple times a day with people saying, I want to exercise. I need the exercise because I feel better. But damn, I'm hungry. I am so hungry when I exercise more.
Yeah.
So I always talk about the right exercise for you, the right amount. If we're overdoing exercise, it can be detrimental. So we got to find that balance. We're getting the benefits, but not the the downsides. The protein. This kind of comes back to Jamal's question. Protein is so important to keep you full. And sometimes we need to time meals differently around the exercise, right before, right after. Some people like exercising fasted. Some people don't feel well doing that. So I think it's very individualized. Do you have any more generalized recommendations?
Yeah, you have to be careful about exercise. Okay. I think it's an old wives' tale that exercising makes you lose weight. And the scientific literature does not bear this out. I talk all the time about obesity being a disease, and this is one of the manifestations. Instead of, in a person who's never been obese, exercise does cause them to lose weight. In a person who has this disease, their body doesn't behave like a well-trained athlete, for example. And so their response to exercise is a lot different. And this is one of the manifestations. It's hunger out of proportion to normal. So and this is one of the reasons we prescribe medication to people. We have on-site pharmacies in both offices, and the medicines are available right here. You got to control that hunger, and you got to be careful about the intensity of the exercise you're doing when you're trying to lose weight. The treadmills these days don't have it on there anymore, but I'm getting to be an older guy. You can tell by the gray and on the sides of my receding hairline and so forth. But treadmills used to have heart rate zones on them. And they had the lowest zone was called the fat burn zone, and that was really where most people were just walking. And that is borne out, in my opinion, to be true. That kind of low to moderate intensity cardiovascular exercise like walking for extended periods of time really causes you to lose weight, in my opinion, and without making you hungry. Think of our ancestors. I always said, did your ancestors join the YMCA? No, they just walked everywhere, and they were thin. And so I think your cells are adapted to this. And so if you are doing boot camp classes and stuff like that, they're good for fitness. But they may not be good for your weight. And it may seem counterintuitive to you, but actually taking, an hour and going for a brisk walk, you may get way more bang for your buck in terms of your weight loss. You'll be a lot less hungry. If you're not on any medication to control your appetite, you need to come see us. We can help you with that, and that will make a big difference. I totally agree, Charlotte. I know you said you do it for mental health, so we understand there are so many benefits, and we're not discounting those other benefits. It's just very important to emphasize the fact that we don't want people feeling discouraged because they're exercising more, thinking they're going to lose more weight, when in fact it can be the opposite. That's right.
So we have to control that hunger. Medication really is a huge help for the patients in our practice.
I would just say, Charlotte, heavier exercise, more intense exercise is good at preventing weight regain once you've lost weight.
Yes, and weight maintenance, exercise, different forms of exercise than just walking are going to be very, very important.
That's
lose
right.
the weight.
But to lose the weight, the lower intensity stuff for long duration seems to work good. So thanks everybody again for joining us today. We really appreciate you being here and sending us your questions. The questions are good. Keep sending them.
Yes.
Right? All right. Stephanie from Holly Springs, are you still offering telephone sessions? If so, do they work? I prefer FaceTime versus just a phone call. Is that an option? Well, what do you think, Michelle?
That's a really good question. So yes, we have always been, and we very likely always will, because we understand that, people don't always have the option to come in, even if they'd like to or prefer it. So at this point, it is over a phone call. not a FaceTime call, but we do have you send in pictures of your weight, pictures of your blood pressure. You give us a diet journal via email. So we are collecting information other than just what we're talking to you over the phone about. So the way they work is a day before the visit, we have you send in the information I just talked about, an email with your weight, picture, blood pressure picture, a diet journal. And then a provider will call you on the day that you have an appointment for a phone visit. And we will do everything that we normally do in the office. We talk about goals. We talk about challenges. We talk about our treatment plan. Do we need to change anything? So there's not that much different about it. And then when we prescribe medication, we can ship it to you, or we can have you just pick it up. We can just bring it out to your car if you don't feel comfortable coming inside.
That's right.
So we try to make it as convenient as possible. Having a pharmacy on site makes that so much easier for folks. And we do not charge differently for a phone visit versus an in-person visit. It is simply, if you get it shipped, there is a fee from the UPS in order to ship it to you. But we can do this throughout the United States. So it does not have to be that you are within North Carolina. We have patients outside of state as well that take advantage of this.
Yeah, that's right. And look, I give patients the choice. We've remained open the entire time. So if you want to come in, I give patients the choice, and still 80 to 85% of all of our visits are in-office visits. People like coming in to do it because they like the accountability. And look, it's a safe environment to come do it. It's always been safe. We're going to ask you some questions about whether you have any symptoms, that sort of thing. We just try to screen out people who really shouldn't be coming in because they could potentially expose other folks. So we do this for the staff. We do it for the patients. We really kind of have a triple screening process. You know, it's kind of hard to make an appointment and then come without us over asking you all of this sort of thing. So I would, if you like that accountability, please come to the office. A lot of people are, and so we've never had any problems with that from the start. Okay.
And if you don't feel well, we ask that you do not come. We will definitely make that telephone visit available. And also, just because you do it once doesn't mean you're locked in and you have to do phone visits. Some people do them every other month or every third month, or just, a few times a year. They come in, the rest of the time they're over the phone. So we have lots of options. So yeah, Stephanie, give us a call. We can make that happen for sure.
That's right.
Thank you for your question.
Yes.
All right, let's go on to Olivia and James from Apex. Both husband and I trying to lose weight, think it might be best to seek professional help. Would we both be able to come in for appointments at the same time? If so, how would that work? So the answer is yes.
Yes.
We encourage it, actually. Yeah. We give discounts for immediate family members.
Teamwork, baby. It works, doesn't it?
Oh my goodness. Yeah. Yes, it really does. So we would love, Olivia, for you to call for you and James to come in together. You can be seen together for your initial appointment and together for each subsequent appointment after that. And just to tie back with Stephanie's question, we do sometimes have spouses that start in person together, but then one of them travels for work. So one will come in the office and we will call the other person, they will FaceTime the other person
while the other one's here.
Exactly. Right? And then the one spouse leaves with both spouses' meds. So as long as we're following the right protocols, we can be very, very flexible. But we have a lot of patients who come with their sister, with their mother, with their spouse, with their child. I mean, we have a lot of different scenarios where we have joint appointments.
Yeah.
Give us a call. It's available.
Right. Yeah, I like the joint visit. I like people pairing up, family members pairing up because that they're more accountable. Look, if you're going to go eat a bunch of Twinkies, I always say, you got to convince your spouse that if you're both doing it, hey, let's go eat those Twinkies together. It's a lot harder to get agreement for two people to do that. So they tend to be, these couples tend to do a lot better.
They do.
In terms of adherence.
They do, absolutely.
And they stick to their guns and they set up an environment in the home that seems very conducive to success. Okay, we have a question in our comments section by, I think, Jaron, maybe. Yeah.
How do you recommend tightening loose skin after weight loss when you haven't exercised during weight loss?
Yes.
Great question. So I will start by saying not exercising during weight loss is not the only way some people will experience the loosening of that skin. We have individuals who do exercise during their weight loss. And unfortunately, that is an after effect for a lot of folks who have lost weight, especially a lot of weight, a large amount of weight. So we have patients who get cosmetic surgery and are very, very happy with arms or thighs. So that is an option if it is to the point that you would consider that. It is very, very successful. And in our practice, there's definitely no judgment, no stigma. If you want to do anything cosmetically, we will support you 100%. We are all about getting you healthy and feeling your best. And so looking your best is a part of that. We're a visual society, so we understand that. On the journey to weight loss, so you may have some tips. I'm a big fan of collagen supplementation, protein in general. So collagen is kind of a subset of protein. It has some different amino acids, which are the building blocks of protein that are very specific for our skin, our hair, and our nails. So getting enough protein, but specifically enough collagen, can be really, really important just to give you the best shot of the elasticity of your skin, kind of still being there and bouncing back a little bit more. What do you tell folks when they ask you about skin?
Yeah, well, there's two things I'll say here. First, you got to exercise. If it's because you've lost weight, you need to be exercising for 6 months to get an idea of what it's really going to look like.
That's very true.
Okay, yeah. So and look, that goes hand in hand with the diet that you talk about that puts the correct emphasis on protein. And collagen's great, right?
Yeah.
I'll say one other thing. I didn't intend to say anything about this. Michelle doesn't even know this. The producers don't even know this. It's top secret information, and I'm just going to divulge it now because this question goes right to the point. So I'm purchasing a machine that will non-invasively tighten that skin because this is a common problem. And it's funny. I did talk to the bank about the loan for it and all that stuff on Friday. And before the end of the year, I'm going to have this thing in our offices. And then next year we'll be offering that as a service. So it's non-surgical, and you'll be able to. The name of the company that makes the machine is InMode, INMODE, and they're a big, fairly sizable company. They're traded on the stock exchange and so forth, and they make really cool technology to non-invasively tighten this, and they get really good results with that, and it with no pain, downtime for you, and so. Yeah, and so as my producer tells me, Paula Abdul is a spokeswoman, and so that is true. I forgot about that, and so anyway, I know a little bit about these sort of machines, and I've been waiting for one like this one to come along because I think it's the most patient friendly. Some of the other ones hurt. This one doesn't hurt, and I like it, and I like it enough that I think we need to offer it to our patients. So that's going to be a service you'll be able to get from us. So that if you're exercising, then you can come get the skin tightening too.
Very exciting.
Yeah, that'll be cool.
Very exciting.
I think you'll really like it. So stay tuned for announcements on that. I got to get the staff and so forth trained up. We'll do an initial promotion and so forth to kind of tell everybody about it. So pay attention, and you'll see it, and it'll be affordably priced too. It won't be crazy.
Thanks, Jaron. That really got us all somewhere.
Yeah,
appreciate it.
yeah. Okay. All right. So question 4 here. Ketogenic diet. This is Ariana from Raleigh. Is a ketogenic diet safe for those with high cholesterol? Yes.
Yes.
Yes. So you would think that. So look, eating fat is not a problem. Okay. Just conceptually, people would eat a steak, for example, and baked potato and a roll and a glass of sweet tea or some sort of alcoholic beverage. And in the past, then scientists would draw some blood sample and say, look, see, you got that's a cholesterol problem. Well,
we're eating all that cholesterol.
And they just said, hey, well, it must be the steak, right? Okay. Well, that was an incorrect assumption. And we had a lot of policy and nutritional advice and stuff based on this. And really what's become evidently clear when you study people who just eat the steak with butter on it, for example, and eat it with vegetables and none of that carbohydrate, guess what happens to their good cholesterol? It goes up. Guess what happens to the free-floating fat or the triglyceride? It goes down. Okay, so it really, that's a very good way to do it. So eating fat doesn't necessarily cause a problem. Watch what you mix it with. Okay, yeah. I always say it's not the stuff in the middle of the biscuit. It's the biscuit that got most people, right? And we blamed it on the bacon or the sausage or the egg or whatever, right? So, your cholesterol is, in my opinion, not going to be negatively affected by ketogenic diet.
I agree. And book recommendation, there's a book called Cholesterol Clarity.
Yes.
That is pretty fantastic at laying out this idea of how we were all kind of duped into thinking that eating fat put fat into our bloodstream, but the body is not that simple. The body is way more complicated, and it really is sugar and inflammation and starches and other predisposition, other lifestyle factors that can really put you at risk. A lot more so if only because of that versus having meat or fat in your diet.
The other thing I would just say there is, Ariana, is that your total cholesterol doesn't carry any risk of anything. Okay, if you look at the Framingham Heart Study, which is the largest one ever done, half of the people who had heart attacks had completely normal total cholesterols. Okay, the other half had elevated ones. So it doesn't matter whether your total cholesterol is 500 or if it's 1,000 or if it's 50. Okay, your risk of the heart disease just from that number is exactly the same.
Right.
So I wouldn't put any stock in the total cholesterol anyway. Okay, it's really not something you need to worry about.
Yes, absolutely. Right. So moving on to Jeff from Cary. I'm ready to begin the keto diet. Was wondering, how long does it take to get into ketosis? Well, I need to consume only 20 grams of carb for the duration of the diet. Heard from other dieters, you can up the carbs once you're at a maintenance level. So 3 very good questions within this one question, Jeff. How long does it take into ketosis?
Most people not long, but
some
people
it does
longer.
depend. It does depend. It depends on the person. There are some individuals who can get in within 24 hours. And there are other individuals who it can take 24 days. That's less likely. More folks are like within a week, I would say.
Most people within the first few days are in it. You make reference to the person that takes longer, maybe have a very high insulin level. So you got to give time for those to come down before you get into ketosis.
Your metabolic health at the start really does matter. So if you're very, very active, Jeff, if you don't really have a lot of metabolic issues, within a few days, very likely.
That's right.
Very likely. Second part of that question, will I only need to consume 20 grams of carbs for the duration of the diet? I find generally not, although in the beginning it is good to be more careful.
Yes.
Most folks can eat 30, 40, maybe even 50 grams of total carbohydrate without any consequence while they're trying to follow a ketogenic diet. That also is individualized, and where your carbs are coming from matters as well. There's net carbs, the idea of subtracting fiber and subtracting sugar alcohols, which are artificial sweeteners that are added to products in order to make them taste good, even if they don't have any sugar in them. So what do you tell people? 20 versus 30 versus?
The lower you go, the better. But everyone's a little bit different. And I've seen people, look, 3/4 of people get into ketosis at 50. So anyway, I guess the idea is, restricting it down until you do is because you're gonna, everyone's gonna be a little different.
Find your threshold. What's your lower threshold? How low do you need to go to get in? And then what's the upper threshold? How high can you then go to stay in? Not get,
and I don't want to give the impression this is the only way to lose weight. We see people doing all sorts of diets. This is just a very common one that we see. So, Jeff, that, if you're not Jeff and you don't want to do a keto diet, don't worry, we're not going to make you do it.
Right.
Okay. More information is available, of course, on our website, simonsmetabolics.com, and you can check that out. So, what is it? He says he heard about other dieters. You get up the carb for the maintenance level. Well, that's pretty easy. You just up it until you start gaining weight. And then you know your limit.
So it is possible,
that's right.
to increase your carbohydrate level in maintenance for sure. But that's individual. So you figure it out with an N=1 experiment, I always say. You are the only subject of this experiment.
Who cares if they average of 1,000 people with something, right? That doesn't really matter.
What matters?
You.
Exactly. Exactly. So thank you for that series of questions, Jeff. That was really helpful.
That's right.
So moving on to Serena from Raleigh. Is it safe to continue keto during pregnancy? I've been a keto dieter for about 2 years now, and I'm not sure if it's safe to continue at this point.
I would say yes. And here's why. Okay. Look, I mean, you're just thinking like an American, Serena. I hate to tell you, but the rest of the world was going on for, millions or thousands of years, however you want to view it, prior to the American experiment. And you know what pregnant women ate back then? animals, what came from animals and what they could grow. They were in ketosis all the time. Everyone ever born on this planet, was born in ketosis, and the moms were in ketosis. So I don't buy the idea that you have to eat a bunch of carbohydrates when you're pregnant.
Yeah, we technically wouldn't be here.
That's right. Correct. The human race would have ended.
Right.
That's right.
Although there is a lot of scary information about that out there, and pregnancy is one of those categories where we don't do a lot of studying, really, if any studying is done. So it is kind of controversial because everyone can have an opinion, but we don't really have any hard research to back it up, except for all our ancestors, which is just a good one.
And that's why I cited that, because you're not going to find a study, and you're going to find a lot of people say, no, don't do it, and all this bad stuff's going to happen. Okay, all right, yeah. I always say, look, that there are essential fats, there are essential amino acids, right?
Okay. Protein.
Yeah, that's right. No such thing as an essential carbohydrate.
No, there is not.
That's right.
No, there is not.
Yeah.
So from our comments, Martha says, sign me up.
Mark, look here.
For the
Martha, you just keep watching, because that thing is really cool. I'm really stoked up about it. And, there was a lot of companies making stuff that I used to have some lasers and stuff in my practice when I first began it, and there was companies making stuff that hurt, and I don't want stuff that hurts. And so this InMode's got the platform that they have doesn't hurt. It's an easy treatment to do. And, look, nothing's as good as going and getting a bunch of stuff cut off during surgery. But if you don't want to do all that and don't want to spend that much money, you can still get, significant results without having to do all that. So
stay tuned, Martha.
Yeah, that's right. Yeah. So is it true? This is Kendra. Is it true that eating after 8 p.m. makes you put on pounds or stalls weight loss? Look, the official answer is no. It's what you eat late, not if you eat late. Okay. So you're going to go, there's this one restaurant chain that says open after midnight or whatever it is, open late, Okay. Well, fast food, if you go there and load up on some of those carbohydrates that they sell, okay, guess what's going to happen to you?
It's not going to turn out
that kind of eating late. Not good. Not good, right? Puts you in a fat storage mode all night. Now, if you ate chicken breast or a pork chop with green beans at 10 o'clock at night, boy, that's making your intestines walk around the track all night long, working to digest that thing. Metabolic rate's higher. And if you talk to any bodybuilder who's trying to cut fat, that's what they do. They eat that sort of thing before bed, or drink that protein shake before bed, because it actually raises their metabolic rate. They burn more fat. So it's what you eat, not if you eat, right? So
the protein shake, I think, is a really good idea. We have folks who all the time are concerned about this very same thing as you, Kendra, where maybe they work a later shift, or they just happen to be a bit more of a night owl, their sleep is shifted, and they're really worried because they're legitimately hungry after the sun is down. They've had like a 6 o'clock meal and they are hungry again at 10 because 4 hours has passed, and that's legitimate hunger. That makes sense. What a protein shake is really, really good for is, one, it's sweet. So anyone having a craving for something sweet, you get it. It can be chocolate, it can be vanilla, it can be strawberry, whatever. And it also doesn't take that much effort to digest. So there are some folks, whether they have reflux or they just don't like the discomfort of having, food in their stomach to have to digest when they're going to lay down to go to sleep. Protein shake is basically already digested for you. So it's very, very easy for your stomach to handle, but still get everything that it needs. So I find myself recommending protein shakes at night a lot for people who ask questions like this. Like, I kind of need to eat, but I think it's too late and I'm worried, or I don't feel well if I lay down with a belly full of food. So that's where something like a protein shake really, I think, comes into play.
We sell some good ones here at the office. There's some right here behind us. And, we try to sell stuff that tastes really good, because we don't want to sell you stuff that tastes bad.
Right.
So the patients tell us what they like, and then that's what we carry. So it's tested by most of our patients and gets broad acceptance amongst the patient population, right?
Right.
So I want to thank everybody for watching. We're about time to wrap up here.
I know, it goes so fast every time because your questions are so wonderful. Keep them coming, please.
Thank you so much for joining us. And look, have a great week, everybody. And we'll talk to you again in 2 weeks. Okay.
Bye, everyone.
All right.